All right, so starting with palpations, the fibular head.
It's right there.
Okay. Common peroneal nerve.
It comes down here and branches out into the leg.
Peroneus longus muscle.
It's at the proximal 2/3 of the fibula and then comes down here and underneath and attaches at the first metatarsal.
Peroneus brevis muscle.
It's the distal 2/3 of the fibula and then it comes down here and attaches on the 5th metatarsal.
Fibular shaft.
That's right here.
Lateral malleolus.
Right here.
Peroneal tubercle.
One's right there.
Calcaneofibular ligament.
One goes right here.
Anterior talofibular ligament.
That one runs from here down there.
Posterior talofibular ligament.
One's back here.
Anterior tibiofibular ligament.
That one runs right here.
Posterior tibiofibular ligament.
Starts right here and comes back.
Peroneus tertius.
That one is distal 2/3 and comes across the foot to the first metatarsal.
Tibial tuberosity.
It's right there.
Gerdy's tubercle.
That one's right here.
Anterior tibial shaft.
It's just down the shin.
Anterior tibialis muscle.
It's right here.
Extensor hallucis longus muscle.
That one's like right in here.
Extensor digitorum longus tendon.
That's at the proximal half of the fibula and then comes down underneath the foot.
Superior extensor retinaculum.
It's up here.
Inferior extensor retinaculum.
That one's down right here.
Dome vitalis.
Right here.
Sinus tarsi.
It's right here.
Medial malleolus.
One's right in here.
Deltoid ligament.
Surrounds it.
Sustentaculum tali.
It's right there.
Tibialis posterior muscle.
That one starts over here and comes behind the leg.
Flexor digitorum longus muscle.
That's the proximal half along here, and then it comes down and under to the toes.
Flexor hallucis longus muscle.
That's the one that comes around to the big toe.
Gastrocnemius soleus complex.
It's right in here,
Achilles tendon.
down here.
Subcutaneous calcaneobursa.
That's the one up here underneath the skin and above the tendon.
Subtendinosus calcaneobursa.
That one's down here underneath the Achilles tendon,
And then calcaneus.
the heel bone.
Alright.
So that's all for palpation. So then we'll go into active range of motion. Start with plantar flexion, so move your foot down. That one's about 49.50, so that's in the normal range. And then we'll go up to test dorsiflexion. That one's about 20, so that's also in normal range. Then we'll do inversion, so move in. One's also like 19, 20 in normal range. Then we'll go eversion, so go out. One's at 5, so that's also normal range. So I'll do passive range of motion. So I'll stabilize up here and grab at the metatarsals. So first we'll go eversion and inversion, and then plantar flexion, and then the first dorsiflexion is like this, and then for the second one we'll have you pull your leg off the table, and then dorsiflexion again. And then for manual muscle testing, I'll stabilize the leg here, and have her push down for plantar flexion, and then up for dorsiflexion, inversion, and eversion. So for all of those, you want to test bilaterally so you can compare to see if one is irregular or not. And then next we'll go into special tests. So for the first one, I'll do anterior drawer test. So I'll stabilize here along the calcaneus and then pull forward. And if there's a lot of pain or excessive anterior movement, that's indication of an ATFL sprain. And then next we'll do talar tilt inversion. So for this one, I'm gonna wanna hold up here and then hold down here with my thumb on the, no, first we'll do eversion. So I'll put my thumb on the deltoid ligament and my hand on the calcaneus. Go eversion. There's a lot of pain or excessive medial gapping that indicates damage to the deltoid ligament. And then for inversion, I'm gonna hold here with my hand on the calcaneus and my thumb over the CFL. Then invert. There's a lot of pain or excessive lateral gapping that's an indication of damage to the CFL. And then next we'll do Krieger's test. So for this one, I want to stabilize the lower leg again, and then dorsiflex the foot, and then evert and externally rotate at the same time. And if there's a lot of pain up here, that's indicative of a syndesmosis sprain. And then next we'll do Potts compression test. So for this one, you want to squeeze with the palm of your hand the tibia and the fibula together. And if there's a lot of pain along any of the shaft area, that's an indication of fracture to the area of the shaft. And if there's a lot of pain on the distal end, that's indicative of syndesmosis or high ankle sprain. Next we'll do percussion's bump test. So if you want to pull your leg a little more off the table, I'll hold here, and then you just want to use the palm of your hand right here and hit the calcaneus semi-hard a few times. And if there's a lot of pain coming up the leg, that's an indication of a stress fracture to either the calcaneus, the talus, the tibia, or the fibula, depending on where the pain occurred. Then we'll do Homan's test. So for this one, you just want to dorsiflex and extend the knee at the same time. If there's a lot of pain in the calf area, that's an indication of deep vein thrombosis, or there'll most likely also be like warmth to that area and like a lot of redness. Then for the last special test, I'll have her flip over on her stomach. And then you want to squeeze along the gastrocsoleus complex down to by the Achilles. And her foot moves, but if her foot does not move when you squeeze that, it's an indication of an Achilles tendon rupture. And then for all of those, you'd also want to test bilaterally again for comparison. And then next you would check the pulses, also bilaterally. So first is the dorsal pedis pulse, so that would be right about right in there. And then next is the posterior tibial pulse, which is right in there. And then now we're gonna test dermatomes. So for L4, you go down the lateral thigh, across the patella, and then down to the big toe. And you'd have them close their eyes and like poke with a sharp and a dull end and see if they can tell which one it is. And then L5, you'd start up on like the more lateral side of the thigh, cross the patella again, come down to in between the first and second toe. And again, you'd want to test the dermatome using sharp and dull. And then for S1, that one comes down side and the top of the foot to the 5th metatarsal, and you'd want to test the sharp and dull again. And then S2 would be more like the back side of the leg, and it'd come straight down to the calcaneus. And then again, test sharp and dull. And then for myotome, for the L4, you'd want to do ankle dorsiflexion. Yeah, dorsiflexion. And then for the L5, you'd want to do big toe extension. And then S1 would be foot or ankle plantar flexion. And then S2 would be knee flexion. So you'd have them pull their leg off the end of the table and test knee flexion. And then again, you want to test bilaterally for comparison. And then finally, you do reflex testing. So for L4 and L5, if you want to pull your leg just a little further off, you test the Achilles or the patellar tendon right here. So like that. And then for S1 and S2, if you want to pull your leg up a little bit. For this one, or for both of these, you test, or you would tap on the Achilles tendon, and this one can be kind of hard to find. Just like that. And then that is all.